Good morning, everyone. I'm Lucy Hubber. I'm the Director of Public Health for Nottingham, and Jules very kindly asked me to come and speak today and asked me to talk about the health and well-being of the population of Nottingham. And she said, make some sort of reference to the history, and sent me a couple of links, which was fatal. I had a long train journey and I've gone down all sorts of historic rabbit holes. I've had so much fun. So I would like to introduce you to my co-presenter today, who is Dr. Edward Seaton. He was the first medical officer of health for Nottingham. And so we're going to do a little bit of time travel. Thank you very much. Ooh was quite the right response there. I expect more oohs as we go through. So it's 1875 and Edward Seaton has been in post for 3 years. Typical Nottingham, city of rebels, they didn't appoint their medical officer until they absolutely had to. By this time, there is a bit of competition between Liverpool and Leicester, who had the first medical officer. Liverpool have laid claim, but they'd had medical officers for about 30 years by this point, and they were driving change in people's outcomes in those populations. Edward earns a pretty good £400 a year, and certainly better than his colleague in Lincolnshire. They've only given him £15 a year. And he's doing such a good job that he's asked for a pay rise to cover the cost of his gig and horse, because he's having to do a lot of travelling. He reports to the Health Committee of the Nottingham Corporation, the forerunner of the City Council as we'd recognise it today. And he's got a couple of key jobs that he has to do. So he has to do a survey of the population. He has to go around, map all of the houses, understand the people who live in those houses, and then the diseases that they're living with. And his job is to try and understand the causes of what's making people ill in the city. It's probably really important to actually understand more history rabbit holes, something about the way that people understood health and well-being 150 years ago. So I've got here that some people are still struggling to accept germ theory. About 20 years before this, there was a guy called John Snow. Does anybody know the John Snow story? There's a couple of public health in the room, so I expect them to be nodding at me right now. John Snow was a doctor in London, and he'd noticed that he was getting lots of cases of cholera, and they were in small patches of the city, and they'd come, lots of people would be incredibly ill, some would die, and then they'd disappear, and then a new epidemic would start. And he thought to himself, there must be a reason for this. There must be a reason why some people are getting ill and not everybody's getting ill. So he did some investigating, and he got himself a map of the area, and he marked on with red pen everywhere that he saw somebody who'd got cholera. And then he looked at what the common connecting factors were. And he realised that it was the water that people were drinking. And in those days, people got their water from water pumps, central pumps in their area. And so he spoke to the local council and said, look, it's the water making people ill. And they said, no, water's really healthy for you. Water's really good. Can't be the water. It must be something. It must be that people are undeserving, that they're obviously not following God enough. So he petitioned and he petitioned and he got nowhere. And in the end, he got himself a wrench and he went down to the pump and he took the handle off the Broad Street pump. And people stopped falling ill and dying of cholera in that area when they stopped drinking that water. So he is the father of kind of public health epidemiology, that study of the causes of diseases. We've also got, at the same time, got Florence Nightingale, who you will all have heard of, I'm sure. And Florence Nightingale was one of the first people to sort of notice that hospitals made people ill. That surgeons, who were very proud of wiping the blood and guts down their aprons to show how hard they were working, were probably making people poorly. So we've got Florence Nightingale, who's currently helping redesign hospitals and thinking about hygiene. And then the other name you'll have probably all heard of is Louis Pasteur, because you drink your pasteurised milk. And 10 years before this, Louis Pasteur first discovered microbes. So first worked out there were tiny little bugs, and it was the tiny little bugs that were making us ill. That was clearly in France. That's one of those foreign things that this country was still at this point not entirely convinced about. So Edward Seaton completed his survey, and what he found were there were two really main causes of death, both infectious diseases, typhoid fever, and I'm not even going to try and pronounce this. TB is what we would call it today. It was consumption, but it was also what we would recognise today as tuberculosis. Both infectious diseases really heavily associated with overcrowding, people being packed in together in small spaces, and typhoid also with poor sanitation and infected water. So people not having the ability to be clean, to wash their food, having sewage in the streets, etc. And you notice that there were some places in the city where there were higher rates of death or disease and high rates of infant mortality. Obviously, he also looked at the quality of housing, because you can't make those assessments without looking at the quality of the housing. And he noticed that there were some areas of really poor housing and lots of overcrowding. So he was really worried about a risk of a big epidemic of disease. And so one of the first things he did was to use a law, and he was the first in the country to use the Improvement Act of 1878. I told you I went down all sorts of rabbit holes. To require people to notify when they found somebody with disease. And that's really important, because that's where you can start to A, track disease, but also then do something about it. He also required people then to be quarantined. So if they had one of the infectious diseases, they had to be quarantined. He condemned 2 areas of Nottingham, had them knocked down because of the quality of housing there. And he also then, with a social justice view, started to challenge the rents that people were paying. How could people live in good quality housing if they couldn't afford to do so? These were not popular decisions. So lots of the doctors said, if you want us to quarantine people, you're going to bring them to a place which is less healthy. Florence Nightingale tells us this, less healthy than them staying at home. And so Edward Seaton said, fine, we'll build a hospital. So they built the first quarantine hospital, which is now on the site of the City Hospital. I think it was called Bagthorpe Hospital. I think some people also called it Heathfield Hospital, but it's the foundations of where we see the City Hospital today. And there are some fantastic letters in the archives from local parishes who were incredibly upset by his survey and the fact that he was insulting their water supply. They said that disease is from God, and that to challenge that is to challenge God, and their water was fine, leave us alone. So what's very clear in this society is there were lots of people who were living in very poor conditions, exposed to risk, and needed some additional help and support. There are lots of reports about people just being one event away from destitution, and destitution would mean the workhouse. And finding yourself in the workhouse would mean separation as a family, would be very difficult to then leave the workhouse and get back into your home. It could be the devastation of your entire family. And mainly led by women, there were lots of charitable, philanthropic events, lots of people donating time or food or visiting to support families that were in need. And in London, 2 women set up the Committee for Organising, the Society for Organising Charity. And the Nottingham Society was set up just 2 years later by Henrietta Carey. And that aimed to systemise that charitable giving, working out that some people were going here, there and everywhere and receiving maybe not quite enough support. And some people were probably receiving too much support because it wasn't organised, it wasn't systematised. And there was a really strong focus about supporting people who were just on that edge of destitution, just on the edge of going into the workhouse, whose husband might have been injured. And unless they get some support now, they would lose their home, they'd be separated as a family. That wasn't always popular. Because they felt as if they were only treating the immaculate poor. They were only looking at people who were deserving, and they weren't getting behind that long-standing causes of poverty. So we're going to travel forward in time now. Ooh is the right response. Thank you very much. So I've been in post since 2021. I came during COVID, and we spent some time, Public Health spent some time in the NHS. We're now back in local authorities, so very much like Edward Seaton. I do now earn the same as my colleague in Lincolnshire, and we both earn about the same as our colleagues in Liverpool. But I do have to pay for my own gig and horse. I don't get any reimbursement for travelling around. My job, and I can summarise this really simply, is to improve and protect the health of the population and reduce inequalities. I report to a Health and Wellbeing Board, many of the members of which are here today. And just like Edward Seaton, I also have a responsibility for mapping the health of the population. So every year I produce an annual public health report, and we sustain something called the Joint Strategic Needs Assessment, very fancy words, but basically you can go onto the Nottingham Insight page and there's some interactive dashboards. You can look at it by ward, you can look at it by different population demographics, you can do some deep diving, how many people would have this condition. That's all available to you. So just like Edward Seaton, I produce that as well. We also then look at the causes of disease and some of those wider determinants, how people work, how they live, what their houses is like, and we make some recommendations for action to the Health and Wellbeing Board. So what is the health of our population? We've seen, and this doesn't quite go back 150 years, I don't quite keep records that far back, but actually 150 years ago, the life expectancy was 43 years for people born in Nottingham. And we've really increased that. So we're above 80 on average between men and women. We've seen an increase. So it has been going up steadily until the last few years, when it has begun to plateau and sometimes in some places, including Nottingham, dip again. So those increases that we have seen caused through the benefits of urbanisation, of better housing, of the welfare state, of improved healthcare, have now begun to stagnate, and we're beginning to see some people really experiencing some challenge. And you can see here, so the top line is England and the solid line is Nottingham. We've tracked England, but we're still beneath. So the life expectancy for people born in Nottingham is less than England. So we live slightly shorter lives. What's really important also to understand here is that our population live more of their life in ill health. So there's something called healthy life expectancy. That's how long you can live before you have a serious condition. And for a woman born in Nottingham, they will live not only a shorter life, but a third of their life with some form of ill health that impacts on their ability to live an unlimited life. Some of the questions we then ask ourselves are, what are the things that are causing that? And you can see it's things like heart disease, lung cancer, respiratory infections, Alzheimer's, different forms of cancer. And then we ask ourselves, so what causes that? Why do people have those conditions? So you begin to get into some of the risk factors. We still have incredibly high smoking rates. And there's something about the history of Nottingham. We used to have, was it British American Tobacco were based here. So we've got kind of like an intergenerational history of smoking. I'm very pleased to say that with the support of Thriving Nottingham, who are downstairs in the bright yellow T-shirts, we are beginning to turn the tide on our smoking rates. We're beginning to see decreases. And until recently, we had the second highest smoking rates in the country. I think we're now 10th. And I'm going to celebrate every move down that we possibly can down that list. We have diseases associated with eating and moving for good health. So the importance of physical activity, the importance of eating a healthy diet, the importance of access to healthy food. Alcohol use, substance use, and you can see really interesting occupational risks are still on here as well. It doesn't stretch that far, so I can't move that on there as well. And also, just like in Edward Seaton's day, child health is on there as well. So some of the things that I'm leading here in Nottingham, many of which I hope you will know, and this is only a taste of all of the work that you will do in this room. This is just my contribution, which is a small part of the difference that hopefully we're all we're all making here. And you can see downstairs, please speak to Ifat and Dale about the Health and Wellbeing Champions and how we can support your work around looking at health and wellbeing. And we've got the bright yellow, the Thriving Nottinghams as well. So what are some of the challenges that we are all facing that's impacting us still? I think, we can't miss the fact that we've got a public sector with really limited resources, and that some very difficult decisions over the last few years and still to come are having to be made. In Nottingham, we've got a very changing population, and we've got a population that shifts and changes as new parts of the world come and join us, new global majorities come and join us, but also changing in terms of age structure. So we're beginning to see yes, a slightly ageing population, but we also have an incredibly young population, not just students, but actually a really young population as well. So we've got people at either end of that age spectrum, and they all bring different needs with us. And we need to be able to move and adapt to what those different needs are. I'm sure that many of you have also noticed the difference in people's mental and emotional resilience, and particularly for children and young people. The world is a really challenging place for young people, and that's going to have an impact on them for the rest of their lives. And so there's lots of work we need to do about that. Social isolation is another factor, particularly for some of our older residents, where people are being brilliantly supported to stay in their own home, but that can mean that they don't get to meet other people. So those of you that provide that social connection, whether it be lunch clubs or community events or knit and natter groups, all of that is incredibly important and valuable. And then we have some changing societal values. So we're beginning to think differently about what's right and wrong. And we're beginning to see some of that challenge and some of that conflict in some of the way that the politics is playing out as well. And meaning that some people are feeling very nervous and very anxious. I'd like to introduce you in that thing about societal values. One of the things that we've noticed is the major impact that stigma has, that the judging of other people, that the treating them as other, can increase people's feelings of anxiety, of feeling isolated, and then not coming forward and not seeking help. So my last annual public health report was around stigma, and we very much worked with local residents to develop their understanding of how stigma was affected. So I'd like to introduce you to Greg, and for Greg to just spend a couple of minutes telling you something of his experience of stigma.
I was destitute at one point and had to pretty much drag myself back up. And it's really hard when some of the simple, most mundane things you're being barred from because, yes, I was sleeping on the streets, or you can't access that because we need an address. Well, yeah, I can't really say on the park bench. It doesn't have an address or a postcode. You need a postcode. So they find that you're constantly getting pushed back, and it doesn't matter because he's a nobody anyway. If you were a teacher or a lawyer or somebody with some status, then it'll be, oh, well, we really need to help you. Here's me dressed in rags and really not feeling very well. And you're just going, go and sort that out first and then come back. But I'm ill today. I might not make it till tomorrow. And it's just desperation. It's always chasing your tail or trying to score a goal when they keep moving the goalposts. That's frustrating. And that's why people get annoyed and start to slate the system that is supposed to be there when we're most vulnerable. And if that's not stigma, I don't know what is.
So I find Greg's words incredibly powerful. And I think they're a real challenge to those of us that work in public sector organisations about how we structure ourselves and make life more difficult. Greg's comments about I'm standing in front of you in rags and you're telling me to go and do something else before you can help me, I think really speaks to some of the challenges we've got where we organise systems for ourselves. What I think it also speaks to is how important the work of NCVS is and its partner organisations, because you are the safety net for people like Greg. It is charitable organisations that scoop people like Greg up and support him so that they can work through our systems and our processes. And there's a real challenge there. There's a real importance about the value of the work that you do, and a challenge for us about how we start to adapt to meet the needs of people, not get people to meet our needs. So in thinking around that, what my rabbit hole searching found was that in the last 150 years, we've made some really significant improvements. And the world has, and people's health and well-being has improved for the better. But some of those challenges, potentially some of the solutions, remain pretty constant. We are seeing people who live in real poverty and are struggling to cope. It's the same challenge of people living in really dire, disadvantaged circumstances, and a whole load of people just teetering on the edge. So my next challenge that I have set myself is to work to develop a system where we can begin to reshape some of that. How do we effectively support people and lift them out of poverty? How do we support people who are just on the edge and make sure that they don't tip across? How do we prevent people from falling into poverty? And then one of the most important challenges is how do we build poverty out? And I think that's where I'm really going to be coming and asking and seeking for all of your advice, because I think the answers lie not with people like me, but with people who you work with. What are the barriers they experience? What do they see as the solutions? What would be the thing that would make a difference for them? And so I'm really looking forward to working with you all about how we can begin to design some of this. So, which means that we've got to think about working together and what are some of our shared principles. And these are the 4 pillars of ethics. So you can't escape me talking without something of a lecture. You're lucky I haven't put any kind of really fancy charts up. So I think our shared principles under this framework are that we all believe in the respect for the individual and their ability to make their own decisions. I think that we're all trying to do good. And we're really trying not to do any harm. And I think what the stigma video shows is sometimes we do harm. But it's not intention, so we need to address that. And I think we're really trying to get to a place where we're moving towards an equitable approach while improving the benefits for both the individual and the wider population. So I think we've got some really strong shared principles. That leads me to then think about what some of the key concepts are from the history of NCVS or NSOC, as it was 150 years ago. So one is about choice and personal agency, about people's ability to have the luxury of choosing. And I spend a lot of time when people say, well, if people smoke, it's just their choice, isn't it? Is it their choice? If people take drugs, that's just their choice. If people only eat unhealthy food, that's just their choice. Actually, if you walk through some parts of Nottingham, I challenge you to find an affordable apple or carrot. I bet you can find an affordable sausage roll or some chips. So choice is, I think, really important and comes from both the history and also the future that we now see. I think one of the great examples around supporting people is Changing Futures, led by Framework, so a charitable organisation, who are building support wrapped around the individual and their needs and finding out what it is that they want and how they can best be supported. I think there's also something around how much support we provide people. So there was very much a focus 150 years ago about short-term support in order to reduce dependence. We now have a welfare state, And we're still having the conversation about how do you create independence for people? How do you move people so that they are in charge of their own life? Advice Nottingham, again, led by CAB and a number of partners, do some tremendous work around that. Tailoring need, not just a one-size-fits-all. And the work of the National Society for Organising Charity was brilliantly advanced. They didn't just dole out money or just dole out food, but they asked people what they needed. So they would buy railway tickets so people could travel to work. They would buy tools so that people could start work. They tailored their support to the individual's needs. And we still see a lot of that now. And the example I've chosen here is the tremendous work of Green Space, of the green social prescribing, and how they understand that people's needs are more than just what they might be presenting with, but that importance of reconnecting with nature. And then, in a society where there are more statues of imaginary men than there are of real women, I think we should note the tremendous role of inspiring women in this story. Whether it's Henrietta Carey and the lady visitors who started this work 150 years ago, or the tremendous women who are leading it now. Jules, I know you don't like the photo. And the fact that we've now got a statue of women in the beautiful green heart of Nottingham, I think we should celebrate that. And we should celebrate also the fact that so many of your organisations are now run not just by women, but by people with lived experience, rather than lovely philanthropic, nice, wealthy people coming and doing too, but actually coming from the communities that they're trying to support, and we should celebrate that too. So I can't quite forecast forward 150 years, so there's no lovely swirling thing here because I'm not clever enough to do that. But actually, I think in that world where we're beginning to shrink statutory provision, the role and your work is going to be incredibly important. And part of what you're going to be doing is providing that voice, that advocacy for people whose voices are less able to advocate for themselves. And it's part of that shift. The more that we can get people's voice in, the more that we can begin to shift from doing to people to doing with people and creating that independence. And then I think there's something about the wisdom, knowledge, intelligence and insight that you can bring that will help shape the future services of the city. What is it going to look like as we move forward? So I'd like to thank you all for the work that you do. I'd like to wish NCVS a very happy, I've just got a really fancy word down here, sesquicentennial, 150th birthday. And I hope you have a really fantastic rest of the day. Thank you.